from the previous videos, which you can find by clicking above, we have seen what happens in the first and second trimester of pregnancy. In this video instead, we will go to see what happens in the last trimester of pregnancy. 7th month, 25th week. The uterus at this point is the size of a soccer ball, and to make room, it pushes towards the other organs, causing discomfort and pain. 26th week. The baby's sleep-wake rhythms are becoming more pronounced. His kicks and punches become more noticeable, and it will be difficult to rest and sleep at night. You may also have restless leg syndrome, a condition that prompts you to constantly move your legs to feel better. 27th week. Your belly is the size of a basketball. It increases fluid retention, which can cause episodes of numbness and tingling in the hands, the so-called carpal tunnel syndrome. 28th week. Relaxin, a hormone produced by the ovaries, loosens your joints and makes it easier to hit furniture, stumble more often, or drop objects from your hands. 8th month, 29th week. Colostrum, rich in antibodies, continues to come out of the breast, which will help the baby in the first days of life to prevent diseases and the most common infections. 30th and 31st week. Sleep becomes difficult, and you often wake up at night needing to urinate. The pelvic area softens and takes on greater elasticity to prepare for childbirth. 32nd week. The hormonal storm, triggered by pregnancy, can cause you what is called amnesia gravidarum. It manifests itself with memory problems, mental confusion, difficulty concentrating, and a sense of loss. 9th month, 33rd week. The fetus is in the final stages of its development. The walls of the uterus are gradually thinning, and therefore allow more light to penetrate inside and let your baby know when it is day and when it is night. 34th and 35th week. The uterus, which is still growing, begins to put pressure on the lungs, on the rib cage, and other internal organs. It is often responsible for urinary incontinence, which causes urine to leak when you laugh, cough, or sneeze. 36th week. You will feel kicks and punches and increased pressure in the lower abdomen as the baby is descending towards the birth canal. At this point, your lungs and stomach will be able to expand slightly. On the other hand, however, it increases the pressure on your bladder. Some women go into a state of hyperactivity, which leads them to tidy up the house, closets, throw out old things, clean and wash. It is the so-called nest syndrome in pregnancy and is typical of the last few weeks before childbirth. 37th week. You need to pay attention to some early symptoms of labor, such as increased vaginal secretions, throbbing pain in the lower back, and close contractions. 38th and 39th week. The uterus prepares and the vagina begins to dilate and thin, allowing the baby to pass through during childbirth. The child is then placed in the cephalic position, that is with the head down and in the perfect position to be born. 40th week. As the website of the Ministry of Health recalls, childbirth can also take place within 4 to 2 weeks. After this period, however, there is talk of a protracted pregnancy. We talk about the prodromal phase, that is preparation, and it is that period of signs and symptoms that precedes the arrival of labor. When the water, or rather the amniotic sac breaks, amniotic fluid comes out, a colorless, odorless, and warm liquid. It represents a clear signal of the impending birth. Through uterine contractions, favored by oxytocin, a hormone naturally produced by our body, and the efforts of the mother, who pushes with all her possible strength, the baby or girl will finally be born. At this point, your wonderful pregnancy journey has just ended.